It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong government complex with simultaneous interpretation available for you in English. We're going to enter the briefing room where Kim Gang-lip, who is the Vice Health Minister as well as overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be sharing the latest figures and updates with us on the COVID-19 situation here in the country, and especially with the sudden spurts of cluster infections that we've seen here in the capital. Vice Health Minister Kim Gang-lip will be briefing us on what's been going on with that and how the government has been responding, as well as other measures that the health authorities have been taking in order to contain further spread of the infection. And he's just taken to the podium and, well, keeping his mask intact, and it looks like he's just about to begin the briefing.
Let us now begin our regular briefing for July 20th, Monday. As of today midnight, we have 4 new local infections and 22 new imported cases. The total number of confirmed cases now stands at 13,771, and a total of 903 people are in quarantine undergoing treatment. Unfortunately, we have 1 additional fatality, and the death toll now stands at 296. I extend my deepest condolences to the deceased and the members of the bereaved family. On January 21st, we have seen the first outbreak of the COVID-19 here in the country, and 6 months have passed. And we are experiencing unprecedented period of time. However, many of the public are also exerting their full efforts to participate in our quarantine measures. And we also know that the public is going through great difficulties as well. And we begin today's briefing by acknowledging the fact that the government is very pitiful in that we do not have a strong solution to this crisis. And in Korea, we had 2 major crises. First, it was centering around the Daegu's Sincheonji crisis. And for the first time ever in its history, Daegu and Cheongdo region has been designated as a special area for disease infection. And in order to prevent curb of the further infections, we have also designated we had a special task force run by the Prime Minister, and he also moved to the region. And we also introduced very innovative ways of tracing, including the drive-through clinics, screening centers, and so forth. And as the number of patients increased exponentially surrounding Daegu and Gyeongdo region, we also introduced the idea of life treatment centers to treat people with no symptoms. And we also designated the life and relief hospitals, and this were able to help us curb a massive outbreak on a nationwide level. Without regional lockdowns, these measures were taken possible due to the quarantine measures and social distancing measures carried out by the public as well. Not only the quarantine authorities, but also the medical practitioners exerted their great efforts, and the number of and the members of the public also exerted their full efforts. And this first step of our crisis was able to be seized in mid-April as the daily number of confirmed cases dropped to its single digits. And this also enabled us to transition into life treatments, life quarantine, and life distancing measures starting in May. However, with another large cluster of infection in the Itaewon Club related cases. In May, we also had an exponential increase of the outbreak. And this has led to the government designating high-risk facilities and also designating special and targeted measures, quarantine measures targeted for each facilities. And we also carried out the implementation of a QR code system for entry log, and we also carried out pan-government efforts to curb the further virus within the community. And with strict preventive measures, and we also have introduced an idea of phased out offline classes for schools starting from 20th of May. And we are also successfully have carried out the general elections in April, as well as a major large-scale public service entrance exam as well. And these were all possible thanks to the members of the public support. And we have seen cluster infections in Daegu, Daejeon, and Gwangju region, and these were able to be minimized thanks to the efforts put forth by the members of the public. Many nations around the world are carrying out an ease of lockdowns, and they are trying to reach in harmony and strike a balance between daily routines and quarantine measures. However, they are met with another second outbreak. However, in Korea, we did not have massive and intensive lockdowns, and we are in the successful stage to manage our routine daily lives together with our quarantine. And we had 4 new local infections today, and this is a very delightful statistics, and this is the lowest since May. And we are also seeing a steady decrease in the number of confirmed cases throughout the nation, and we have a great confidence that we can combat the virus going forward. And this was all possible due to the participation and consideration and understanding of the members of the public. And the members of the public here in South Korea carried out the quarantine measures, including wearing face masks and so forth. And we were also able to introduce the first public rationing system for face masks as well, thanks for the understanding and consideration of many of the public. And we are seeing an increase of the imported cases. However, the government stands fully committed to reducing these imported cases. And we have introduced the systems of 2 weeks of mandatory self-quarantine for all of the foreign entrants, as well as a special entry system for all of the foreign entrants as well. And we are also trying to assure the public that we have a low possibility that these imported cases will spread to local transmissions, as they are under tight control. And now is a time for us to prepare for a possible prolonged war against COVID-19 based on our know-hows and experience of the past 6 months. And first, we would like to make sure that our quarantine guidelines will be supplemented and they will be upgraded so that they can be practical for our publics. And also, we will ask the business establishments as well as institutions to develop and to move over the possible innovative ways to implement these quarantine guidelines. And starting from tomorrow, we will have a 5 stages of experts forum. And during this forum, we will discuss and analyze the achievements made so far, and we will also prepare our solutions going forward in a mid to long-term level. And we could be experiencing a possible resurgence of the virus in the future. And in preparation for this, we will make sure that we have enough supply of medical masks and medical equipment as well as hospital beds. And we will also provide to full extent our financial support for the hospitals that have seen some financial losses. And we will also fund and support our medical practitioners so that their level of fatigue does not go overboard. And we will also make sure that we have good access to possible vaccine and treatment when they are developed. And as we have a greater concern on the so-called corona flu, which is a state of mental depression that accompanies the disease, we will make sure that we provide full support for the public so that they can overcome such mental disorders. And furthermore, we will also, based on our successful experience and know-how, we will cooperate fully with the other countries, and we will establish a practical scheme for coordination. And we will also make sure that our disease control and prevention headquarters will be equipped with full experts. And we will also make sure that we will carry out a government reorganization backed by the National Assembly so that we can increase our expertise and capacity as well as capability going forward. And until we have an effective vaccine and treatment against the virus, the COVID-19 battle will be a prolonged one, and we could also expect that we will also live with the virus going forward, and therefore we cannot let our guards down as of yet. However, our government is very strongly confident in the energy that our public has shown, and we ask for all of the members to prepare for a possible resurgence of the virus as it was the case for May, and we also ask for your participation going forward. The central government will also exert its full efforts to prepare for a possible prolonged war against the COVID-19. And of course, there could be some sacrifices to a certain extent, but we will make sure that we will guarantee the routine daily lives for the public. Thank you very much.
That was a live briefing from the South Korean health authorities updating us on the COVID-19 situation in the country. The Vice Health Minister just told us that there were 26 additional cases of COVID-19, bringing the total accumulated number to 13,771, and most of these were imported cases. There was unfortunately one additional death, bringing the total death toll to 269. Well, that wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regular midday newscast. Bye for now.